Hey guys, welcome to another question of the day. Today's question has to do with age. And the question was, am I too old to have surgery? I love this question. And the reason I love this question is because I've done cosmetic procedures in patients who are 80 years old, and I've done them in patients who are 14 years old. So let's talk about the spectrum and why that happens. I've had 14-year-olds who have done surgery and who have enormously large breasts, and they cannot function because their breasts are so large, and I've done breast reductions in them. I've done procedures in patients who are 80 years old for the same reason, something like a breast reduction, because they've wanted it their whole life. So how do I decide which one of you or who is okay to have surgery? What it boils down to is this. It has nothing to do with your age. It has more to do with your health. If you're a healthy patient and you don't have a lot of comorbidities, meaning high blood pressure, diabetes, things that would make you a very high-risk person to have surgery, then you can have surgery. The one thing that I will assure you is that when you come to see me, we look at your history and physical examination. We go over everything that's going on with you physically, and we look at what kinds of comorbidities and other diseases you may have, and we determine whether we think you're safe for surgery or not. In addition, there are certain age limits where we have to get EKGs or certain lab values. Now, I get labs on everybody because sometimes young patients come to see me and I'm the first surgeon or the first doctor they've ever seen, and I want to know, are they anemic? Because if they are anemic, they may need to be put on iron before surgery. So what we do is, when you're at a certain age and you do have some of those comorbidities, it doesn't mean that you can't have surgery. It means that we need to risk stratify you. And the way we do that is we risk stratify you into high risk, moderate risk, or low risk. I send everyone to see their primary care physician to get a full battery of lab tests, an EKG, as well as a physical examination. Your other doctors and I will then talk to each other to determine what is your risk stratification. If you're someone who's high risk, we're probably not going to do a surgery for an elective procedure. If you're someone who's a low risk, I'm sure you're going to be safe to have surgery. If you're someone who's in that moderate risk category, we have to take into account what kind of a procedure we're doing, what you're having done, and is that going to be safe for you. There is no such thing as a no-risk surgery. Everyone has some type of a risk. I can tell you this, most patients that I see are nervous about having general anesthesia or being put to sleep. And I always joke and tell people that you have a better chance of dying in a car accident on your way to my office than you do from having a general anesthetic if you're a low or moderate risk patient. So together, me and your physicians and my team are going to look at you as globally as a whole person and look at all the things that are going on with you, and we're going to decide whether you're a safe candidate for an elective surgery or not. So I hope that helps answer your question. Again, you guys ask the question and I will answer it. Have a great day.